During our public consultation and in the many months before that in which we were engaging members of the public about our plans, the single most common thing that people have asked us about is travelling to and from the site. The reason we haven't put our ideas about how we can improve travel to the sites in the consultation is that we didn't want to jump the gun. We wanted to hear from the public about their issues with transport and access to our sites currently and what they think the implications of the new centre might be. We also wanted to hear their ideas about how we could improve access to the sites, and we have heard several very imaginative solutions proposed. We intend to bring those back after the consultation and to use them to formulate a range of options which can help people get to the new elective orthopaedic centre as easily as possible. We've been talking to our county council partners for many months about these proposals, and particularly the Joint Health Overview and Scrutiny Committee. That group has formed a working group to look at transport and access to the elective care centre, and it involves partners from local government, from our commissioners and from our hospital services, as well as our voluntary sector groups. That group is already starting to look at a range of options that we can use to make it easier for people to access our services, including road access from the Northern Approach Road, parking immediately next to the centre, access by patient transport services, the partnership with community voluntary sector transport organisations, and a range of other ideas. So we expect to be able to say much more about this during the decision-making process after the consultation. Some people have asked how we will attract the best staff to work in this new centre. The elective care centre will be a large state-of-the-art facility for excellent orthopaedic care. The working environment, the quality of the services and the excellent staff we have already will create a beacon for the best surgeons, nurses, therapists and supporting staff for many years to come, and that will be a significant benefit to our trust and to the people that we serve. Some people have suggested that the plans for the elective centre represent a downgrade of the Ipswich Hospital. I'm absolutely clear that that's not the case. We want Ipswich Hospital to be a vibrant and successful hospital serving its local community for many years to come. Most of our investment over the next 5 to 10 years, including a brand new emergency department and urgent treatment centre, redesign and refurbishment of the breast unit, the children's unit, dermatology, neurophysiology, outpatients and the creation of new laparoscopic theatres all represent our commitment to the future of the success of Ipswich Hospital. We've been engaging with our orthopaedic colleagues for many months now. However, we recognise that there's a lot more engagement and detailed planning work that we need to do, not just with orthopaedic services, but with all of the services that support excellent planned care. The public consultation comes quite early on in the development of these proposals, and that's a requirement of the guidance under which we have to do these things. Once we've got through the public consultation, if we're successful with the recommendation from our clinical commissioning groups, then we begin the detailed planning process, and we have many, many months in which to get the input from all of our other staff to design rotas, the skill mix, the working patterns, the clinical pathways, and importantly, to consult with any staff whose working pattern or job role might change as a result.